So, introduction. A profession that is ignorant of its past experiences has lost a valuable asset because it has missed its best guide to the future, by B.W. Weinberger. Dentistry has a long and fascinating history. From the earliest of times, human beings have been plagued by dental disease. Many of the remarkable techniques used in modern dentistry can be traced to the very earliest of times in every culture. The Egyptians. Hezi was the earliest dentist whose name is known. He practiced about 3000 BC and was called chief of tutors and physicians. Egyptian pharaohs were known to have suffered from periodontal or gum disease. Radiographs of mummies confirm this fact. That being said, how long has dental disease existed?
Since mankind?
Yes, it has always existed. Exactly. Okay. Hippocrates, from 460 to 377 BC, earned the title of Father of Medicine. Aristotle, from 384 to 322 BC, was the great philosopher. He referred to teeth in many of his writings. Diocles of Carystus, physician of Aristotle's time, recommended rubbing the teeth and gums as oral hygiene instruction. What do we do when we rub the teeth and gums? What is this called?
Brushing.
Yes, brushing. Good job. The Chinese. By 2000 BC, the Chinese were practicing dentistry. Around the 2nd century AD, more than 1,000 years before dentists in the West, the Chinese developed a silver amalgam paste for fillings. And that's the silver or like the black paste that we see in people's teeth when they get fillings done. Ting To Tung and Yu Shu described the entire process of swallowing in the 11th century. The Romans. Several Roman physicians wrote extensively about dentistry. Many people still believe in the theory of the tooth worm being responsible for toothaches. The Romans were skilled in restoring decayed teeth with gold crowns. They had a high regard for oral hygiene. The Renaissance. Leonardo da Vinci studied human anatomy and sketched every part of the human body. He was the first to differentiate between molars and premolars. Ambroise Paré was the father of modern surgery. Pierre Fauchard was the founder of modern dentistry. He developed dentistry as a profession independent from medicine. In early America, Robert Wolfendale was one of the first dentists in the colonies. John Baker, MD, practiced dentistry in New York, Boston, and Philadelphia. George Washington was one of his patients. Does anybody know a fact about what they used to say about George Washington and his teeth?
That they were made out of wood?
Yes, that his dentures were made out of wood. Good job. Okay, so Paul Revere, everybody has heard of Paul Revere, the famous colonial patriot, was a silversmith who became a dentist. He is credited as the first to use forensic dental evidence to identify human remains. Do you guys know what forensic dental evidence means?
Yes, when somebody dies, they can identify someone by their teeth.
Yes, according to their teeth and their dental records. Good job. Okay, so which artist distinguished molars from premolars?
Leonardo da Vinci.
Good job. Isaac Greenwood was the first native-born American dentist. He studied under Dr. John Baker. John Greenwood was the second son of Isaac Greenwood. He served in the American Revolutionary Army at the age of 14 years. He later became a dentist like his father. Educational and professional development in the United States. Horace Hayden and Chapin A. Harris laid the foundation for the profession of dentistry. Together, they established the first dental college, the Baltimore College of Dental Surgery. Today, the college is known as the School of Dentistry at the University of Maryland. So, which famous colonial patriot first used forensic evidence? Anybody remember from the previous slide? We said it was Paul Revere, right?
Yes.
Okay. Dr. Green Vardaman Black, 1836 to 1915. Known worldwide as G.V. Black, he earned the title of the Grand Old Man of Dentistry. Black standardized the rules of cavity preparation and fillings. He developed the principle of extension for prevention. He taught in dental schools, became a dean, and wrote more than 500 articles and several books. Wilhelm Conrad Röntgen. This Bavarian physicist discovered X-rays in 1895. His discovery revolutionized diagnostic capabilities and forever changed the practice of dentistry. Why do you guys think it changed the practice of dentistry? With X-rays, why do you think?
Because x-rays can show you something that sometimes your eyes can't see.
Correct. What you can't see physically in the mouth, sometimes you can see it in the X-ray. Good. Horace Wells, 1815 to 1848. Dr. Wells, a dentist, is credited with the discovery of inhalation anesthesia in 1844. This was one of the most important medical discoveries of all time. He realized the potential for pain-free dentistry through the use of nitrous oxide. And we mostly see this with what age group? The nitrous oxide.
For kids?
Yes, for kids because it helps them relax for dental treatment. Good job. Women in dental history. In the 18th and early 19th centuries, dental schools throughout the world did not accept female students. Women such as Lucy B. Hobbs Taylor and Nellie E. Pooler Chapman broke those barriers. Emmeline Robert Jones became the first woman dentist in the United States. At 17 years of age, she worked for her dentist husband, who trained her in his office to become a dentist. She later opened her own dental practice. Today, women are active in dental associations, specialties, public health, and the military. It is projected that by the year 2020, 20% of all dentists will be women. What do you think is one advantage that women have over men when being dentists, when it comes to the physical? Anybody want to take a guess?
Maybe that our fingers are, I don't know, they're thinner than men?
Yes, our hands are smaller and our fingers are thinner, which means that it's easier for us to work in a patient's mouth than it would for a man. Good job.
Thank you.
Lucy B. Hobbs Taylor. She was denied admission to a dental college. Lucy B. Hobbs Taylor went to work for a dentist who trained her in his office to become a dentist. She later opened her own dental practice in Cincinnati and then opened a dental office in Iowa. Dr. Hobbs Taylor was admitted to the Ohio College of Dental Surgery and was the first woman to graduate from a dental school. Okay, so does anybody remember who earned the title of Grand Old Man of Dentistry?
J.V. Black.
Yes, good job, G.V. Black. African Americans in dental history. Ida Gray, 1867 to 1953, was the first Black woman in the country to earn a formal DDS degree and the first Black woman to practice dentistry in Chicago. She graduated from the University of Michigan School of Dentistry and practiced dentistry in Chicago until she retired in 1928. In 1929, she married William Rollins and used the name Dr. Ida Gray Rollins. In 1867, Harvard University initiated its first dental class. Oh, I think I skipped something, sorry. Okay, Ida Gray, no, I already went through this, sorry. In 1867, Harvard University initiated its first dental class and accepted Robert Tanner Freeman as its first black student. African Americans have been appointed deans and faculty members at a number of American dental schools. American Indians in dental history. Dr. George Blue Spruce Jr. is the first American Indian dentist in the United States. He is currently the Assistant Dean for American Indian Affairs at the Arizona School of Dentistry and Oral Health. Jessica A. Rickert became the first recognized American Indian female dentist in 1975. She received the 2005 Access Recognition Award from the ADA for leadership in helping people gain access to dental care. C. Edmund Kells, a New Orleans dentist, is credited with using the first dental assistant. She was a lady in attendance, making it respectable for women patients to go into a dental office unaccompanied. Why is that? What was going on before in the older times with women and their husbands?
They weren't allowed to do as much.
They weren't what?
Allowed to like do as much as men.
Exactly. And they were not allowed to go anywhere by themselves unless they were accompanied by their husbands. So now, if there was a lady in attendance, aka a dental assistant, a female one, the women were allowed to go to the dentist without having to have to go with their husbands because there was going to be another female there, basically. Dr. Kells soon realized that this lady could be a valuable asset, and by 1900, he was working with both a chairside dental assistant and a secretarial assistant. Hazel O. Torres and Anne Ehrlich co-authored Modern Dental Assisting in 1976, aka the book that you guys are using, Modern Dental Assisting. Became the first major textbook written by dental assistants for dental assistants. The combination of Ehrlich's journalistic abilities and Torres' clinical expertise created the foundation for a dental assisting textbook that would set the standard in dental assisting education for years to come. So, guys, the book that you guys are using has actually been around since 1976. Every time that we're up to the 13th edition, every time that they make a new edition is because they've added maybe something new in it, some type of technology or some new information that has been discovered or is being used since the previous edition. Who was the first African American female dentist in the United States? Does anybody remember?
What was the question?
Who was the first African American female dentist in the United States?
That was Ida.
Yes, Ida Gray Rollins. Good job. The history of dental hygiene. Irene Newman was the first person to be trained as a dental hygienist in Bridgeport, Connecticut in the early 1900s. A dentist, Alfred C. Phones, believed women could be trained to provide preventative services, allowing more time for the dentist to perform more complex procedures. Dr. Phones opened the first school for dental hygienists in 1913. The school exists today as the Phones School of Dental Hygiene at the University of Bridgeport. Dental accreditation. By 1900, the profession of dentistry had become well established and dental schools were being developed across the country. The educational requirements for dentists, dental hygienists, and dental assistants have increased dramatically over the years. Today, the Commission on Dental Accreditation, aka the CODA, of the American Dental Association, which is also the ADA, sets standards and accredits dental education programs. Accreditation assures the students, public, and profession that a program meets high standards. The Natural Museum of Dentistry. The Dr. Samuel D. Harris National Museum of Dentistry is an affiliate of the Smithsonian Institution. It is built on the grounds of the Baltimore College of Dental Surgery, the world's first dental college. The museum provides many interactive exhibits, historic artifacts, and engaging educational programs. Visitors learn about the heritage and future of dentistry, achievements of dental professionals, and the importance of oral health in a healthy life. Okay, does anybody remember who founded the dental hygiene education in America? Name star.
Was it Alfred C. Phones?
Yes, good job. Alfred C. Phones. Very good job.